Hello, dear doctors, nurses, medical student, and healthcare team. How are you today? I hope you are well. Here we are going to talk about another question. Okay, a 50-year-old man with diabetes mellitus suddenly develops persistent crushing central chest pain radiating to the neck and arm when he was driving. Okay, it's likely myocardial infarction. It was associated with nausea, vomiting, dyspnea, and palpitations. He has a pulse of 122 beats per minute, a blood pressure of 110 on 70 mm Hg, and a respiratory rate of 34 breaths per minute. What is the single most likely diagnosis? In A. Angina, B. Costochondritis, C. Dissecting aneurysm, D. Myocardial infarction, E. Pulmonary embolism. It's most likely, according to the patient's sign and symptom in the patient history, it's most likely myocardial infarction. Here we are going to explain it. The characteristics are classic in myocardial infarction. The pain of a myocardial infarction can be somewhat similar to dissecting aneurysm, as we can see in the patient sign and symptoms. But myocardial infarction is much more common than aneurysm dissection. The examiners would have to include something specific to dissecting aneurysm for that to be the answer, such as history of severe tearing chest pain radiating to the back with a history of Marfan syndrome. In dissecting aneurysms, the history of Marfan syndrome is important, and unequal pulses in upper extremities is also important in aneurysm dissection. If you would see any of these key phrases, you should stop and consider dissecting aneurysm as their answer. Okay. A 55-year-old man who suffered a myocardial infarction a few days ago is now ready for discharge. His medical history remains significant other than the myocardial infarction he had. He has no drug allergies. He has already been put on aspirin and clopidogrel. What is the single most appropriate medications to be given to him on discharge? A. Statin only, B. Statin and warfarin, C. Statin and AC inhibitor, D. Warfarin only, E. Heparin only. And the answer is statin and AC inhibitor. Here we are going to explain it. Okay. All patients with MI on discharge must receive dual antiplatelet therapy like aspirin and clopidogrel. Aspirin is continued lifelong, but clopidogrel is only for 12 months. And beta blockers, we must offer beta blockers for patients who present acutely with MI as soon as they are hemodynamically stable. We must continue beta blocker for at least 12 months after an MI in patients without heart failure, and we must continue beta blocker indefinitely in people with heart failure. NCE inhibitor must be offered to patients who present acutely with MI as soon as they are hemodynamically stable, or angiotensin receptor blockers for patients who are ACE inhibitor intolerant. And statins must be offered for all patients with MI or the patients with high cardiac risk factors. Okay, here was a short explanation about patients with MI on discharge. First, dual antiplatelet therapy like aspirin and clopidogrel, beta blockers, ACE or angiotensin receptor blockers, and statins. Okay, another question about cardiology. A 52-year-old man underwent a hemicolectomy. A few days after his operation, he develops chest pain and a temperature of 38.8 degrees Celsius. He is having rigors and night sweats. On auscultation, a systolic murmur is heard. As we said in the history of patients with endocarditis, this patient is febrile. He has a new murmur which is heard on auscultation, and the history of hemicolectomy. Here are three criteria which we can think about endocarditis. What is the next single most appropriate investigation? A. Computed tomography scan for the chest. B. Abdominal ultrasound. C. Chest X-ray. D. Blood culture. And E. Liver function test. The best choice is blood culture or echocardiogram, but we have no the choice for echocardiogram. Blood culture would be the choice here. Here we are going to explain it. This is a case of infective endocarditis, as we explained in another question of cardiology. The most appropriate investigation is blood cultures or echocardiogram. Since echocardiogram is not one of the options, blood culture should be picked, and it's the best answer. This was a short explanation about three of our patients coming with different complaints. Thank you for your attention.